It seems like everywhere you look these days, there's some new tech vying for our attention.
It really
But what
does.
happens when tech starts to deal with something as personal as our mental health?
That's a great question.
Well, that's what we're diving into today, the world of digital mental health interventions.
It's a really fascinating area, especially because it's changing so rapidly. Who has access to mental health care?
And that.
And this brings up both possibilities and some really important questions.
Absolutely. And we've got a great stack of sources to kind of help us break this down.
Yeah.
We're looking at research from the Journal of Family Medicine articles, from The Conversation, and we even have some studies on telemedicine applications.
Wow.
We really want to help you understand how these digital tools are changing things,
Yeah.
not only for those seeking help, but also for the professionals who are actually providing it.
It really is a rapidly changing landscape, and whether you're personally interested, professionally involved, or even just curious about how tech is shaping our world, there's something here for everyone.
Definitely. And one thing that really jumped out at me across all these sources is this idea of accessibility. These
Mm.
digital interventions are often much easier on the wallet and just plain easier to get to compared to traditional therapy.
And that's particularly huge for people in underserved communities and those in more remote areas.
Yeah,
Think about it.
absolutely.
These are folks who might have transportation challenges or limited clinic hours or even just a shortage of qualified professionals in their area.
Oh, absolutely.
Digital interventions can actually bridge that gap.
That's where Semba Cox research really hit home for me.
Yeah.
They talked about digital therapy being an opportunity for people from rural and remote regions to get high-quality consulting and advice.
Mm.
But what does that high quality actually look like when we're talking about outside of a traditional therapy room?
That's the million-dollar question, isn't it?
I think so.
It's not just about throwing an app at someone and calling it a day, right?
Right.
We need to think about how to ensure those same standards of care. Confidentiality, effectiveness.
Right.
How do all of those things translate to the digital space?
Right, because it really is a whole new set of challenges.
It is.
And it also makes you wonder, could this shift the power dynamic in mental health care?
Hmm.
We've all heard this term e-patient. But what does it actually mean when someone's using an app to track their moods and access information and essentially manage their own mental well-being?
Yeah.
Is that empowering?
Right.
Or could it feel isolating?
Well, the Journal of Family Medicine and Primary Care highlighted 3 specific advantages of these mobile therapies.
Okay.
First, they allow for tracking and organizing health information.
Okay.
So imagine having all of your mood logs, your medication reminders, even sleep data, all in one easily accessible place.
That would be amazing.
Second, you have access to reliable information about your condition at your fingertips, which can be incredibly empowering.
Okay.
And finally, and this is perhaps the most significant benefit, it facilitates self-management. Digital tools can equip individuals with strategies to cope with anxiety, manage stress, and even practice mindfulness techniques,
Wow.
really putting them in the driver's seat of their mental health journey.
It's a really compelling argument for these digital tools, and I have to ask this, is there a risk that we lose something crucial in this shift? I mean, there's something so powerful about sitting face to face with another human being
Yeah.
who's truly listening and empathizing with your struggles.
You've hit on, I think, the core tension here.
Yeah.
Digitalization of mental health interventions.pdf really emphasizes that clinical psychology at its heart is about human connection.
Yeah?
It's about building trust and rapport, understanding individual nuances, and tailoring treatment plans to each person's unique needs.
Right.
Can an algorithm truly replicate that?
That's where I get a little skeptical.
Ah,
I mean, you can't really reduce the complexity of human emotions to lines of code, can you?
it's tough.
There's something irreplaceable about the shared humanity of therapy.
And this concern isn't just theoretical either. Yeah.
Innes and Morrison, those researchers from The Conversation argued that AI could potentially replace a large part of a psychologist's work.
Really?
Think about things like initial assessments, basic counseling, even delivering cognitive behavioral therapy exercises. Those could potentially be automated.
Wow.
Now, whether that's a good or bad thing is a whole other discussion.
That's definitely a lot to think about.
It is.
And speaking of things that make you wonder, let's talk about data privacy. We all know that anything digital comes with a question mark about privacy, but when you're dealing with mental health information, it feels even more sensitive.
Absolutely. This isn't just about targeted ads. This
No.
is about potentially vulnerable information that could have real-world consequences if it falls into the wrong hands.
Absolutely. And Lustgarten's 2020 study really emphasized this,
Yeah.
talking about the consequences and risks for client privacy in this whole digital mental health realm.
Mm.
It's enough to make anyone think twice before hitting download on that mental health app. It really is a valid concern, for sure. We
Yeah.
need to be asking, how are these companies handling our data?
Yeah.
Are they prioritizing security and confidentiality?
Yeah.
And how do those digital footprints potentially impact someone's future, especially when we're talking about something as stigmatized as mental health?
These are huge questions.
They are.
And they tie directly back to that concern about AI potentially taking over parts of a psychologist's work.
Right.
If algorithms were actually making decisions about our mental health, who's ultimately responsible?
Yeah.
What happens when things go wrong?
It feels like we're in uncharted territory here.
Absolutely.
And that's both exciting and a little unnerving.
Yeah.
It seems like we're on the verge of a paradigm shift in mental health care.
Yeah.
And we need to be asking these tough questions now to ensure that this new landscape is one that truly benefits everyone.
I completely agree.
Welcome back to our deep dive into the world of digital mental health interventions.
It does feel like we've covered so much ground already. Exploring digital mental health interventions.
Yeah.
We went from the basics of accessibility
Right.
and those concerns about human connection all the way to the potential of AI to, reshape how we understand and treat mental health.
It's a lot.
Yeah, it is a lot, so much.
Yeah, and yet it still feels like we're just scratching the surface.
I think so, too.
The possibilities and the challenges, they're so vast.
It really does feel like we're staring down this incredible new world, but one that has some pretty significant risks as well.
Right.
So how do we make sure that we're moving forward in a way that benefits everyone?
Something that really jumped out at me from all of this research
Yeah.
is that it's not really a question of choosing technology over human interaction.
Right.
It's about finding a way for the two to work together,
Okay.
where each one is making the other better.
I like a partnership rather than a takeover.
Exactly.
So how would that work in practice?
Okay, so picture this. You're struggling with anxiety. So you turn to a digital tool for help. Maybe it's an app that walks you through some breathing exercises. Provide some basic information about anxiety management techniques.
Right.
It could even track your progress over time and offer some personalized feedback.
So it's like a digital guide or coach
Exactly.
that's helping you take those first steps toward managing your mental health.
Exactly. But what if your anxiety is more severe or you're struggling with some deeper issues?
Yeah.
That's where the human element becomes essential.
Okay.
The digital tool could seamlessly connect you with a qualified therapist who can provide that in-depth support, empathy, personalized guidance.
Okay, so it's like a bridge almost
Yeah.
between the digital world and that essential human connection.
Yeah.
I'm starting to see how these two approaches could actually work together quite well.
And this brings us back to that question of AI potentially replacing psychologists.
Yeah.
It's not necessarily about replacing, but rather changing the nature of their work. As AI takes on those more routine tasks like initial screenings or basic therapy exercises, psychologists can focus on more complex cases. They can delve deeper into research, really push the boundaries of therapeutic innovation.
It's almost like they're leveling up their skills,
Exactly.
becoming even more specialized in the art and science of mental health care.
Precisely. Think of it this way. Imagine a world where psychologists are freed from the burden of administrative tasks
Okay.
and
Yeah.
basic counseling, allowing them to dedicate their time and expertise to those who need it most.
Okay.
Individuals with complex trauma, severe mental illness, or those seeking highly specialized therapeutic approaches.
That's a powerful vision of what the future could hold.
Right.
But let's be real for a second. We can't ignore the data privacy concerns.
You're absolutely right.
How do we ensure that people's most sensitive information is protected in this digital age?
We need to be incredibly vigilant about data security and privacy when it comes to mental health information.
Yeah.
It's not just about preventing data breaches. It's about establishing clear guidelines for how this data is collected, stored, and used.
So it's about building trust and transparency into these digital platforms from the ground up.
Exactly.
Right.
We need those strong privacy regulations, those clear consent protocols, and data storage systems that are Fort Knox level secure.
Wow.
But beyond those technical safeguards,
Yeah.
we need to be having open and honest conversations about the ethical implications of using AI in mental health care.
And this is where I think it's really important to bring in the listener's perspective.
Yeah.
What are your biggest hopes and concerns about the future of mental health care in a digital world?
Right.
What role do you see technology playing in your own mental health journey?
Mm.
We'd love to hear your thoughts on all of this.
Now, shifting gears a bit,
Okay.
let's talk about the potential for AI to actually revolutionize how we understand mental health.
Okay.
Imagine algorithms that can analyze massive data sets of brain scans,
Wow.
genetic information,
Mhm.
even social media activity,
Mm.
to identify those subtle early warning signs of conditions like depression or anxiety.
It's incredible.
It
It's
is.
like we're talking about preventative mental health care,
Yeah,
catching things before they even fully develop.
that's the potential.
Wow.
And beyond early detection,
Yeah.
AI could help us personalize treatment plans in a way that's never been possible before.
Okay.
Picture an app that tracks your mood, your sleep patterns, even your voice tone to adjust your therapy program in real time.
It's amazing.
It's like having a virtual therapist who's constantly adapting to your needs, ensuring you're getting the most effective support possible. You're
Wow.
getting it. But of course, with such powerful technology comes the responsibility to use it ethically and thoughtfully.
Of course.
We need to ensure that these AI systems are designed with fairness, transparency, and human oversight at every level.
So let's talk more about that human oversight.
Okay.
How do we make sure that AI is a tool that empowers mental health professionals
Yeah?
rather than replacing them altogether?
That's where collaboration and continuous learning come into play.
Sure.
We need mental health professionals involved in every step of that development process, from designing the algorithms to interpreting the data
Yeah.
and ensuring that the AI's recommendations are aligned with best practices.
Okay, so it's like we're building a partnership
Yep.
between human expertise and artificial intelligence,
Exactly.
where each brings its unique strengths to the table.
Precisely the human element of empathy, intuition, ethical judgment
Yeah,
will always be essential in mental health care.
I agree.
AI can be a powerful tool, but it's up to us to ensure it's used responsibly and ethically.
We've talked about data privacy and the need for transparency, but what about the potential for bias in these AI systems?
Right.
How do we make sure that they're serving everyone equally and fairly, regardless of their background or circumstances?
That's a critical issue.
Yeah, it is.
We need to ensure that the data used to train these algorithms is incredibly diverse and representative of the entire population. We can't have AI perpetuating existing inequalities or creating new ones.
Right.
It's about building systems that are sensitive to cultural differences, social determinants of health, and the unique needs of each individual.
It's like building safeguards into the very DNA of these AI systems,
Yeah.
making sure that fairness and equity are core principles, not just afterthoughts.
And that requires ongoing vigilance,
Yeah.
constant testing and refinement, and a willingness to challenge our own assumptions and biases.
Right.
The technology is evolving rapidly, and so is our understanding of its potential impact.
That's what makes this entire conversation so fascinating.
It is.
And frankly, a little daunting.
Yeah,
We're at a pivotal moment in the evolution of mental health care.
we are.
And the choices we make now will have ripple effects for generations to come. Welcome back to the Deep Dive. It feels like we've covered so much ground already in our exploration of digital mental health interventions.
We have.
We've gone from the basics of accessibility and those concerns about human connection all the way to the potential of AI to actually reshape how we understand and treat mental health.
It really is incredible.
It is. And in the last part,
Yeah.
you mentioned AI potentially revolutionizing mental health care. It sounds exciting and also a bit like a sci-fi movie.
It's definitely a field that's pushing the boundaries.
Yeah.
Let's bring it down to earth a bit
Okay.
and talk about some specific applications.
Okay.
Imagine a world where AI is helping us to understand mental health in ways that we never even thought possible before.
Okay.
Think about algorithms that can analyze massive data sets,
Hmm.
brain scans, genetic information, even social media activity,
Wow.
to identify those subtle early warning signs of mental health conditions.
That's incredible. So it's
Yeah.
like we're moving towards a future of preventative mental health care.
Yeah.
Instead of waiting for a crisis, we could be identifying and addressing potential issues before they even fully develop.
You got it. Early intervention is key, and AI could be a game changer in that regard.
Why?
But it's not just about early detection. AI can also personalize treatment plans
Okay.
based on an individual's unique needs and characteristics.
Okay.
Picture an app that tracks your mood, your sleep patterns, even your voice tone,
Yeah.
to adjust your therapy program in real time.
Wow. It's almost like having a virtual therapist who knows you better than you know yourself,
Right.
constantly monitoring your progress
Yeah.
and adapting the treatment plan to make sure that you're getting the most effective support.
That's the idea.
That
But
is incredible.
as we kind of explore these possibilities, those ethical considerations that we keep coming back to,
Right.
they become even more important.
Of course.
We need to make sure that fairness, transparency, and human oversight are built into these AI systems right from the start.
Yeah. The potential for bias in these algorithms
Mm.
really stuck with me from our earlier conversation.
Mm.
How do we make sure that AI is serving everyone equally and fairly, especially in a field as sensitive as mental health,
Right.
where those biases could have some really serious consequences?
It's a crucial question, and we need to approach it from multiple angles.
Okay.
First, the data that's used to train these algorithms
Yeah.
needs to be incredibly diverse and representative of the whole population.
Right.
We can't have AI perpetuating existing inequalities or creating new ones.
Absolutely.
It has to be sensitive to things like race, gender, socioeconomic status, cultural background.
So it's almost like making sure the AI is seeing the world through a diverse set of lenses,
That's a great way to put it.
not just a narrow or biased perspective.
And beyond diverse data, we need transparency in how these algorithms work.
Yeah.
We can't treat them as black boxes.
Right.
We need to understand the logic behind their decisions.
Huh.
If something seems off or unfair, we need to be able to identify why and then fix it.
So it's about holding these AI systems accountable,
Yes.
not just assuming that because it's technology, it must be neutral or objective.
Exactly. And finally, and this can't be overstated, human oversight is absolutely crucial.
Yeah.
Mental health professionals need to be involved in every step of the process. Designing, developing, implementing, evaluating. Yeah.
AI can be a powerful tool, but it's up to us to ensure that it's used responsibly and ethically.
It really does feel like we're talking about a partnership between human intelligence and artificial intelligence.
It is.
Each brings their own strengths to the table, and together they have this potential to create something really transformative.
Yeah, the vision. But it's
Right.
not going to happen overnight.
Right.
And it's not without its challenges.
Right.
It's going to require open dialogue, collaboration across disciplines, and a willingness to adapt and learn as the technology evolves.
You've given us so much to think about as we wrap up this deep dive.
I know we have.
What's the one key takeaway you hope our listeners will walk away with?
I think the biggest takeaway is that we're at a really pivotal moment. The future of mental health care is being shaped right now.
Yeah,
And it's really up to all of us to engage in these conversations.
absolutely.
Ask those tough questions and advocate for a future where technology empowers us to live mentally healthier lives. That's a really powerful message. So to our listeners, we leave you with this final thought.
Yeah.
What role do you see technology playing in your own mental health journey? What hopes, concerns, and ideas do you have for the future of mental health care in a digital world? Keep exploring, keep questioning, and keep the conversation going.
This has been The Deep Dive. Thanks for joining us on this journey of discovery.